Hello friends, today we are going to discuss here about urethral trauma. This is most commonly seen in male patients owing to long length of urethra. The most common mode of injury is blunt injuries. So guys, urethral injuries is more common in male patient. Why? Because the size of urethra in male is larger, okay? Or long. Urethral injury is classified in two ways. First is anterior urethral injury, where you find bulbar or penile urethral injuries. Most common cause is crushing of urethra due to saddle injury. Saddle injury when cyclist or running cycle and he fall down, then saddle injuries happen. Posterior urethral injury, P for posterior and P for pelvic fracture, mostly associated with pelvic fracture. Prostatic or membranous urethral injuries. Part of urethra is prostatic urethra and membranous urethra. Most common cause pelvic fracture. Most common presenting feature of urethral trauma is blood at meatus. When you find blood at meatus, that means there is a urethral injury with inability to pass urine. Two more things: blood at meatus with inability to pass urine. Single gentle attempt of catheterization can be taken if retrograde urethroplasty facilities are not readily available or patient in a shock. If patient is shocked or unstable and you don't have facilities of RGU, then you take single gentle attempt of catheterization. The primary aim in the management of urethral injury is establish the urinary drainage in acute settings. What is your primary aim? Urinary drainage you have to establish. The difference in definitive management depends on mode of injury. If you want a definitive mode of management, then you need to find mode of injury. For urethral injury, whether there is a blunt or penetrating injuries, in penetrating injury, if possible, primary repair is the management of choice. In penetrating injury, you have to do primary repair. While in blunt injuries, delayed reconstruction is done. You can delay. In blunt injuries, there is also initial role of endoscopic realignment if expertise is available. When posterior urethra is associated with complex pelvic fracture, definitive surgery treatment with urethroplasty. You have to go and do urethroplasty if complex pelvic fracture is there. Should be performed after the healing of pelvic ring injury. Firstly, you have to establish pelvic fracture fixation, then you go with urethroplasty. What are the clinical features suggestive of urethral injury? That is blood at meatus, perineal laceration, scrotal hematoma, urinary retention, difficulty or inability to insert urinary catheter, superiorly displaced prostate on rectal examination. So, guys, I hope it's clear till now. Thank you. If you like this video, put like on it. If somebody is new on my channel, please subscribe this channel for more such trauma and surgery topic wise videos. Thank you, and this helpful in ATLS also. Thanks.